Give me like a real world example.
There were 16 CCOs statewide.
Hey guys, Jesse Pion here with the Salem Business Journal Podcast. And today I have with me Sheamus, who's the CEO of Yamhill Community Care. All right, Seamus, welcome on the podcast. How you doing today?
Thank you. I'm doing well. How are you?
Oh, I'm doing just dandy. Do you live in Yamhill County? What do you live at?
I do. I live in Newburgh, yes.
Well, there's a cafe there. I forget the name, but it has like these burgers that are like stupidly low price. And I don't want to tell them that because I don't want them to raise their price because they easily could.
Yeah.
But like it looks like a 1960s style cafe. They've got like ice cream, burgers. I mean, it's like, oh, it's so good. And it's super cheap. I was astonished. I almost moved out to Newburgh just for that cafe.
There you go. That's how great Yamhill County is.
Yeah. Well, anywho, welcome to Salem.
Thank you.
You know, I'm glad you were able to make the trip. To start out, what is a coordinated care organization?
Great question. In 2012, Oregon created what's called CCOs, Coordinated Care Organizations, to manage the Oregon Health Plan. And these are regional organizations that pay the doctors and the hospitals and the dentists and many other providers for folks who are on OHP, the Oregon Health Plan, right, which is Oregon's Medicaid, which is essentially our state's version of Medicaid.
Okay.
And CCOs operate under what we call a global budget, and they're fully at risk for the costs of doing the business. And that means that we're responsible for paying for the members' care within a fixed budget and maintaining reserves in case costs in a given year are higher than what might be expected or budgeted. And so the underlying goal then is simple, but powerful. Keep people healthier, reduce avoidable hospital use, and reinvest the savings into prevention and community health.
I want to make sure I'm hearing you right. So what you're saying is the state essentially passes on the risk to these companies that are a little bit more local and better able to handle that kind of risk. Is that correct? Instead of it all being at the state level?
That's correct, yes.
Okay. And that's useful because they understand the local doctors and hospitals better than just the overall statewide.
Yes, that's exactly right.
That ties into the topic that we had for today, which is the Quality Incentive Program. What is the Quality Incentive Program?
So in 2013, the first year that CCOs were in full operation, Oregon launched something called the Quality Incentive Program, or the QIP. And the program focuses on about a dozen evidence-based health measures selected by clinical and policy experts. It's a transparent committee and group.
Is there like a financial incentive for the performance of the program?
Yes. Some call it a bonus, but it's really best understood as a performance-based withhold.
Okay.
So a portion of a CCO's budget is set aside, and to earn it back, a CCO must meet at least 3/4 of the quality pool metrics. And so, for example, if there are 12 measures, a CCO needs to hit at least 9 in order to get that incentive payment.
I think I'm getting the concept, but could you give me like a real world example, like something that I can picture?
So using 2024, the most recent year with finalized results, there were 16 CCOs statewide. And about the 8 CCOs earned 100% of their quality incentive payout, ranging from about $6 million for the smallest CCO to roughly $100 million for the largest CCO. The other 8 CCOs left a portion of their incentive dollars on the table, unearned. And that totaled about $28 million statewide. And so that $28 million then went into what's called a challenge pool, and that challenge pool then was redistributed to CCOs that met certain challenge pool measures. Now, for YCCCO, a smaller CCO serving about 35,000 members in Yamhill County and surrounding areas, the total was approximately $8.5 million from the base quality incentive pool, right? Plus, then, we earned about $855,000 from the challenge pool. And so after accounting for withheld taxes and total payout was roughly about $9.5 million, they came back to the Yamhill community for investment into the community and additional payments to providers.
Wouldn't it just be easier to increase the provider rates instead of just focusing so much on this data?
I'm so glad you asked that question, right? A lot of people do. And there's an old saying that what gets measured gets improved, right? And so the QIP, the Quality Incentive Program, is one of the clearest examples of Oregon paying for outcomes instead of just volume, right? So there's a real return on investment. And because real dollars are attached, we can share those funds with the providers who are actually delivering the care. And it takes extra work to meet the ambitious goals around vaccinations, right? And dental sealants and chronic disease management and more. So at YCCCO, we reinvest about 90% of our quality incentive dollars back into investments in the community. These are upstream investments that are proven to have long-term population health, but also in value-based payments to providers. So that means the providers share in both the accountability and the upside. If they meet the metrics, they can earn a reward. But it also means that investments get made in the community in such things like, housing or childcare and those types of things. The program also drives continuous improvement. So benchmarks are intentionally aspirational, and CCOs can qualify through improvement targets as well. But as measures stay in place every year after year, those improvement targets are getting harder and harder, raising the bar and embedding a culture of quality into the system.
I've experienced this in real life in a way, in a different scenario, because a lot of times when you raise the bar, right, you hit a sales goal. I worked in retail for a long time, right? When you hit a sales goal, and then the next year they raise the bar, and then you hit that sales goal, but you're already performing as good as you can, and then they raise the bar again, then it becomes eventually unachievable.
Sure.
So here's a great example of this. I worked at Wells Fargo when I was but a lad. Right out of high school, I ended up getting a job at Wells Fargo, and during Wells Fargo, I don't know if you remember in 2015, they got in a lot of trouble. And they got in a lot of trouble because a lot of bankers across the country were committing a lot of fraud. And they happen to be bankers who work for that company. Whether or not other banks were doing it, they're just the lamb that was slain, I think. But the problem was their incentive program, right? So what was happening was they would set sales goals, and they told the bankers, hey, we want you to open X amount of accounts over the course of the year. And then they started hitting those numbers. And then okay, well, now you did that, so we're going to raise it even more. And then they hit those numbers. And then they're like, okay, well, now we're going to raise it even more. And of course, these bankers are incentivized to get the reward. And so then you have people start edging on the, cusp of ethics and then hit the reward. Then they pushed it even further. Okay, now we have this even more aspirational sales goal. And then eventually became to the point where it just wasn't achievable for a lot of people. And then people were committing a lot of fraud in order to hit their sales goals because they want to get paid, And so that's what can happen a lot of times when, you keep pacing your goals too high. Now, does that play into it at all?
The goals or the benchmarks do get higher, and they get more challenging. And I think that there is a question sometimes on a certain metric. How many children out of the population can we really vaccinate, right? You're going to get to a point where there's no more children to vaccinate.
Yeah.
Right? I mean, you're just to a point where everybody who wants to get vaccinated has been vaccinated, and that's it, right? So how do you set a benchmark above that, right? So that could be a real life example. So there are questions like that.
So in a similar note, right, just like if you have the goal of vaccinating X amount of kids, you can only vaccine up to 100% of them, right? And so there's going to be a max that you can reach, and you can't keep raising the bar. And it sounds like they keep raising the bar.
Yes, and this program actually has a very positive impact on vaccines. In fact, it saves lives. I mean, if you think about it from an incentive perspective, if you're being incentivized, right, to make phone calls and go out and get people who aren't vaccinated yet vaccinated, that makes a huge difference. And so being incentivized to do that is really important.
Well, and also making sure that the incentives that you're putting there make it so people want to go out there and do it. It can do it, right?
Correct.
So making it so, because on the other end of this, right, when we're just talking about incentives, the impact of this is lives.
Absolutely.
And so it's kind of like when people talk about, not wanting to pay taxes, right? Really what they're saying is, I have to feed my family and I'm struggling to pay my bills. But we just talk about the dollars, but really it's about this. And so we're talking about just dollars today, but on the other side of these dollars are real lives that are impacted. Are Oregonians any better off because of this program?
Yeah, absolutely. This isn't just about saving money. It's about quality of life. And better health outcomes mean fewer hospital visits, better managed chronic conditions, healthier pregnancies, and longer, healthier lives. It means people can spend more time with their families and doing the things they love to do. And enabling providers to make a little extra money means they can keep their doors open to serve more Oregon Health Plan members as well.
Yamhill Community Care, your organization. It seems as if you guys have been pretty successful at this, correct?
We have. And when we looked at the data recently, since the program began, we found that YCCO has earned 100% or more of its quality incentive every single year since we've been a CCO. So for 12 consecutive years, we've met at least 3/4 of the quality measures and earned challenge pool dollars as well. So based on our analysis, YCCO is the only CCO in Oregon with a perfect 12-year record.
What is it that enabled that level of success? Because that's a long track record. So that's not just, a lot of times, people will hit a win, just like sports teams do this all the time, right? They'll hit a win, they'll get their one win, and then, they plummet back down. But to do that for 12 years, that's quite a feat. Like, that means that it's not just you and it's not just like one thing, but you must have good systemic reasons behind why that's the case.
Yeah, absolutely. We get asked that question a lot, and I like to refer to it as our secret sauce, right? YCCO is a community-founded and community-led. We are not owned by an insurance company or a hospital system. Our board includes leaders from across the community, so county government, hospitals, primary care, behavioral health, dental providers, faith-based organizations, early childhood services, and housing. The people delivering care locally are directly involved in the decisions that shape our system. So we call this our collective impact model: shared accountability, shared goals, and shared success. And we are intentionally small. While much of healthcare is consolidating under the idea that bigger is better, our experience shows that smaller, locally governed systems can generate millions in savings through better health outcomes.
What is the future of this program, of the incentive program?
I'm really glad you asked that question. It's an important one. And unfortunately, the program is currently under threat. Last year, due to state budget crunch, OHA and the legislature cut the program by $97 million, about 1/3 of historic payments on a per-member basis. So those cuts directly reduce funding that flows to providers. And for 2026, OHA has proposed an additional $195 million cut, which would eliminate more than half of the program's budget. Now, for YCCO, using our 2024 payout as an example, that scale of reduction would mean at least $5 million less flowing to providers for the same work, the same expectations, even though they hit every metric.
What would you say to people who are the decision makers? I would assume it's the legislature, correct?
Correct.
So what would you tell them if they're listening?
Medicaid is already the lowest payer in the system, right? It pays less than any other form of insurance. And the Quality Incentive Program helps narrow that gap, especially for primary care and maternity care, where these dollars are critically important. Think about it from a provider's perspective, right? It's really important for Medicaid members, OHP members, to have access to care, primary care, for example, right? But when I'm running a business as a provider, I need to determine what percentage of, Medicaid members can I actually have on my panel and still have a thriving business, right?
Yeah, for sure.
And the lower we pay, the less percentage of folks they're going to have on their panel. So what does that do? It just it reduces access, right?
Yeah.
And that's a key thing, is access. And so the QIP is also a primary engine for value-based payments in Medicaid. Providers are willing to take on risk only if there's meaningful upside. That's how we move from paying for volume to paying for health, allowing providers to focus on higher need patients while maintaining financial stability. If we continue to cut the main funding source that enables value-based care in Medicaid, we undermine the very reforms that the state has worked for over a decade to build.
It sounds like that there's a lot at stake right now.
There is, absolutely.
And what do you think the odds are? What's it looking like right now, as far as, are there any legislators already that are looking at it? Or is it just kind of, up in the air? How are things looking right now?
Yeah, so I think there are legislators that are definitely concerned. I mean, we have legislators that are providers, right, or have been providers in the system. So they understand the mechanics of this. And so I think there are concerned legislators. I'm just not sure that there's enough concerned legislators to actually save the quality incentive program. And that's extremely concerning to the provider community.
Sheamus, thank you. We got very deep on, incentives, healthcare, that sort of thing, which is a world I don't typically know a lot about. But it was great to learn from you about this program that I didn't know even existed.
I think the last thing I would like to say is that this quality incentive program is extremely important to the state. Not only is it about, incentivizing providers to provide better health care and achieve quality health outcomes, it has real life impact on the people who receive the Oregon Health Plan benefits. And so I think that the legislators should really think twice about reducing the quality incentive program.
I hope some of them hear it, and I look forward to hearing the discussions about it. I think that'll be this legislative session is going to be an interesting one.
Yeah, absolutely. And I'm sure that a lot of us CCOs will have a lot to say about it.
You know what else they're going to have a lot to say about? That diner out in Newburgh. It is so good. We have to go check it out.
Okay. All right. That's what they're going to do.
In fact, let's go right now. What are we doing here? Seamus, thank you so much for coming on the podcast. I appreciate it.
You're welcome.
Thank you so much to Compass Visuals and Hotel Salem for sponsoring the podcast. Appreciate you guys. Thank you.